think it's...
You ready?
Yep.
Okay. All right, then. If everyone is here that's going to participate, I'll call the Salina Fieldhouse Lender, Inc., the leverage lender regular meeting to order for this October 5th. Wrong one. Let's change. Let's instead have the Salina Fieldhouse Qualified Active Low-Income Community Business, the Qalic B, annual meeting. And this October 5th, time is 2:30. I'm going to call the meeting to order and ask the clerk if we have staff confirmation that Kansas Open Meeting Act required notice has been properly filed.
Yes.
And do we need a roll call for this meeting, or will the clerk just record the attendance?
I can just record attendance.
Okay, thank you. Item number 2 is approval of the minutes. You have the minutes as from the November 18th, 2019 meeting. Is there a motion to approve the minutes?
So moved.
Second?
Been moved and seconded to approve the meeting minutes of November 18th, 2019. All those in favor say aye.
Aye.
Any opposed? That motion passes 4-0. Next matter is new business, 3.1, election of officers, president, vice president, secretary, and treasurer. In the past, that has been the slate of members of the city commission. Would someone like to make a motion for those positions? I think you can do them as a group, Mr. Franz.
Okay, I presume that they're in the order of the positions?
Yes.
Okay. I would move that we appoint Michael Hobbick, Melissa Rose Hodges, Trent Davis, M.D., Carl Ryan, and Rod Franz as the members and officers of the Salina Fieldhouse Qualified Active Low-Income Community Business, Inc. Board of Directors.
Second?
As clarification, we probably need to call out the officer positions of president, vice president, secretary, and treasurer. The order that you read them in is kind of the order that they were previously elected. So the mayor was elected as the president, vice mayor is the vice president.
Okay, you want me to restate that then?
If you could, please.
Okay, that we appoint Michael Hoppick as the president, Melissa Rose Hodges as the vice president, Trent Davis, M.D., as the secretary, Carl Ryan as the treasurer, and Rod Franz as the member.
Second?
Thank you. Thank you, Mr. Franz. I should have been clear about that. All those in favor say aye. Aye. Any opposed? That item passes 4-0. Is there any other unfinished or other business?
I could offer an explanation. This meeting is a required element of the new markets tax credit financing. The organization of the Qalic B, as well as annual meetings, are requirements of that funding. I would tell you that the flooring has been installed for quite some time now. It looks good. I guess the fourth time is the charm in terms of getting everything installed and in place. But both the material and the appearance of the material itself, as well as the alternate aesthetic, I think look like a noticeable improvement over the prior floor. And that was all done at the contractor's expense and no expense to the city, the Qalic B, or the leveraged lender.
Debbie Pack, Director of Finance. I also wanted to just let you know where we are in the process of financing. We are working on the final documents to submit to the lenders and those that require those documents. We had to do a survey at the Fieldhouse. That's being completed. Once that's completed, I believe the Qalic B portion of the financing will be complete. We do have to carry on audits and things like that for, I believe, 7 years for the new market tax credits, but the financing part should all be distributed with sometime this year.
And I would also note that when the Qalic B was established, you delegated administrative authority to the city manager and staff to carry out the tasks that Ms. Pack described.
I notice in the minutes that there was a requirement that we approve the insurance package for this in the last meeting that we had, so is that gone away now? We don't have
The
to-
insurance is in place, and they just asked for confirmation of certificate of insurance. In fact, I think we have a document for your signature as correspondence to them confirming the insurance is in place, but it's not necessary to renew it on an annual basis.
Thank you. Is there any other unfinished business or comments from the commissioners? Is there a motion to adjourn?
So move.
Second.
All those in favor, please say aye.
Aye.
Any opposed? This meeting is adjourned.
So the leverage lender meeting is scheduled for 2:45, so we've got a little bit of and we have outside parties that are members of the leverage lender, so they should be arriving between now and 2:45. Mike, Todd, Samantha Angel, who can't be here today, and Mark Ritter, who's on his way. Okay.
Okay. I gotcha. Today we're electing officers.
Correct,
I gotcha.
within the
Okay,
leveraged lender.
I gotcha.
Should we go ahead and call this to order?
You've got a quorum.
All right. All right, we're going to call to order the meeting of the Salina Fieldhouse Lender, Inc. Leverage Lender. First item of business is we need staff confirmation that the Kansas Open Meeting Act required notice was properly provided.
Yes.
It
It
was.
was, uh-huh.
Okay. The next item of business is the approval of minutes. Do I have a motion to approve the minutes from the May 6, 2019 meeting?
So moved.
Second?
It's been moved and seconded that the minutes of the May 6, 2019 meeting be approved. All in favor, say aye.
Aye.
All oppose? Motion carries. Our first item of new business is the election of officers, president, vice president, secretary, and treasurer. The current officers are myself as president, Samantha Angel, vice president, Mark Ritter, secretary, and Carl Ryan has been the treasurer. Do I have a nomination for the officers?
Yes. If possible, I'd like my motion to be that we maintain the current slate of officers, if you're willing to still serve, that we maintain the current slate of officers in their respective positions and add Mayor Hoppick as the treasurer to replace Carl Ryan, if that's all right with you.
Second?
Okay. We have a motion and a second that the current slate of officers would continue with the exception of Mayor Mike Hoppick taking the place of Carl Ryan as treasurer. Is there any discussion? All in favor, say aye. Aye. All oppose? Motion carries. Do we have any unfinished or other business that needs to be discussed?
Todd, for your benefit, the other two have already heard this, but the flooring has been in for a while now in the field house. The new subfloor has been repaired and the new tile is in. I think the material itself is noticeably better, and I think the pattern, the color scheme is also noticeably better. So we finally achieved acceptance of the flooring system and moved on.
Good, good. Glad to hear it. Any other business to be discussed? Okay. I have a motion to adjourn.
So moved.
Second.
All right, it's been moved and seconded that we adjourn. All in favor, say aye.
Aye.
Aye. All opposed? Motion carries. We are adjourned.
You ran a heck of a meeting.
Yeah. Pretty efficient, huh?
Okay, it is 3 o'clock, and I will call the City Commission study session to order. Today we will have a presentation by the Tobacco 21 Coalition, and I will turn the microphone over to Parks and Rec Director Chris Cotton for introductions and let him move us forward.
Good afternoon, Mayor Hoppick, members of the commission. Yes, I'd like to introduce Rachel Biker with the CKF Addiction Treatment Center. She'll be giving you a brief presentation on tobacco-free parks, and then I'll follow up with a few comments, and then we'll stand for questions.
Okay.
Well, good afternoon, everybody. Like you said, my name's Rachel Beaker. I'm with CKF Addiction Treatment. I am the Wellness and Prevention Coordinator there. I hold the CDRR grant, which is the Chronic Disease Risk Reduction Grant. We've already, you might be familiar with the grant. It's already been in action in our community throughout at least the past 10 years, part of the original smoking ordinance that went through Salina. So it's already had quite an impact on our community. We work towards actions, physical activity, nutrition, and tobacco cessation. I do have some items here, if I can approach and hand those to you. Some of these you may have already seen. Chris handed them out, but I did throw in Hutch's ordinance as well. So some of it's repeat and some of it's new. So with that, we will move forward with just a basic presentation on tobacco-free parks and the benefits that we could see in our community. So first, we cannot have a presentation about elimination of smoking in public until we have talked about smoking first. Smoking harms nearly every organ in the body. Though we have gained much ground in the arena of tobacco cessation, tobacco use still remains the #1 cause of death in the United States. There are also disparities amongst certain groups and subgroups, including those with lower income, poor mental health, and minority and racial groups. The new normal that COVID-19 has brought includes this emphasis on lung health. Though much research is still being done, the WHO has stated that there are currently no peer-reviewed studies that directly estimate the risk of hospitalization. However, they are finding that statistical significance associated between smoking and the severity of COVID, including admission into the intensive care unit. And I did start preparing this presentation about a month and a half ago, and so I double-checked to make sure. And there's still studies that are being done on the direct links, but like I said, there's nothing, no peer-reviewed out there yet. They are finding statistical significance related, though, and I did find a meta-analysis of a total of 11,590 patients, and among the smokers, 29.8% experienced disease progression, compared to 17.6% of non-smokers did not or experience the disease progression. So there is that link that they're showing more positive COVID cases and more progression. So secondhand smoke is going to be one of the main points of smoke-free park ordinance. Secondhand smoke is the smoke from the burning end of the cigarette or other combustible tobacco product. This can also include the smoke vapor that is exhaled from e-cigarettes. Research has shown that there is no safe level of secondhand smoke. According to the CDC, secondhand smoke causes an estimated 41,000 deaths nationally each year. 7,300 of those are from lung cancer. 34,000 are from heart disease. Secondhand smoke can cause respiratory illness and persistent adverse effects such as asthma. Exposure to smoke can also trigger asthmatic reactions while children are at play. Now that's a very, very, very important piece. E-cigarettes are not a safe alternative to conventional cigarettes. The aerosols contain harmful substances such as cancer-causing agents, volatile organic compounds, ultrafine particles, and heavy metals such as nickel, tin, and lead. E-cigarettes are not considered an FDA-approved cessation aid. So as you can see, 35.2% of all secondhand smoke exposure occurs in outdoor and public areas. So more of it is happening in our public spaces than, say, inside of a vehicle, inside the home. And this is something we do have control and power over. So now some facts that are actually centered around just Kansas. And these are also reflected in the handouts that you were provided. As you can see, 1 in 4 adults in Kansas use tobacco products. Almost all started smoking before the age of 18. And remember this as we begin talking about social norms. Almost all start smoking before the age of 18. Only 1 in 3 are aware of quitline services. More than 1/3 of Kansas high school students were exposed to secondhand smoke in indoor and outdoor public places. And looking at this data, we can use a comprehensive tobacco-free policy to address a multitude of issues facing our public, including cessation efforts, by being able to promote the quit line on our signage, prevention efforts, which we can explore more again in the social impacts, and also protection efforts from the damage of secondhand smoke. So this graph, this enhances the data that was shown in the previous slide. Again, these are numbers from 2017. That was the last time that KDHE collected this data. All this data is directly from KDHE. And again, smoking remains the leading preventable cause of death. The rates in Kansas pretty much mimic the national average. 17.4% in Kansas adults currently smoke. National average 17.1. So why policies? Tobacco prevention and control activities are public health's best buy. Evidence-based, statewide tobacco control programs that are comprehensive, sustained, and accountable have been shown to reduce the number of people who smoke, as well as tobacco-related diseases and deaths. Eliminating secondhand smoke by enacting smoke-free protections is necessary to reduce the number of deaths, illnesses, and losses from productivity that result from exposure each year. And that's from the Truth Initiative. It's one of our resources and websites that most of us in public health go to really, they offer just fantastic information, facts, and up-to-date data. So now we will go to health impact, environmental impact, social impact, and economic impacts of these policies. So first, health impacts. We have discussed the individual impacts that smoking can have. Policies extend beyond the individual to protect park staff and park visitors, including children. Policies protect others from harm by preventing exposure to secondhand smoke and also preventing accidental ingestion of cigarette butts by children and pets. Smoke-free environments also create an environment that reinforces quit efforts by limiting the availability of places for an individual to smoke, therefore eliminating the number of cigarettes smoked. This environment is also supportive of others who are wanting to quit and others who may never even have thought of quitting. By promoting this healthy outdoor space and noting resources for quitting on the signs, which I can view, I have examples of the signs that we can use momentarily. So now environmental impacts. Up to 2/3 of all cigarettes smoked end up being littered. So if you think of the 383,000 Kansans who smoke, 2/3 is quite a bit of cigarette butts that end up in our streets, in our parks, and in our waterways. Cigarette butts are photodegradable, not biodegradable. They are made of a material that is only broken down by ultraviolet light, and that takes about 10 to 15 years. An estimated 80% of all cigarette butts in the United States do end up in our waterways. A new environmental impact that we are going to see emerging is the disposable e-cigarette. I added that on there. It's the puff bar, and also just other, I've been noticing more litter and trash from other e-cigarette products. The puff bar can now be purchased and disposed of when the user is done. This presents a whole new issue of plastic waste that we haven't even yet to begin to see. So the social norm impact. This is kind of a big one. Social norms are the social rules that we live by. These are not hard and fast rules, and that's what's great. They are fluid and can change over time. More importantly, social norms can be and are shaped by policy. Smoke-free, tobacco-free park policies change social norms by denormalizing smoking in outdoor spaces, which we've already seen that with our current smoking ban. Visible efforts like these smoke-free policies shift the norms around smoking and create healthy environments by positive modeling. Smoke-free policies can help reduce youth initiation through this positive modeling behavior. Nearly 9 out of 10 daily cigarette smokers first try cigarettes by the age of 18. This is what they're seeing. This is the social norm that we have created. Children imitate adults. Those are big key points as we're looking forward at a smoke-free park, a place where children tend to gather. There is a reminder that youth vaping and tobacco use has been on the rise. It declined, and since the creation of the vape products, it has steadily been on the rise to epidemic proportions. So please refer to the handouts that I gave you that you've already reviewed, and on more statistics regarding youth vaping, and this is all data from KDHE. So our economic impact. The World Health Organization states that with up to 2/3 of every smoked cigarette discarded on the ground, between 750 million and 1.5 billion pounds of tobacco product waste litters the world each year. Cleanup and disposal are costs of tobacco use not currently borne by the producers or the users of the products, but rather government and local authorities. One analysis of the direct cost of butt litter cleanup was done in San Francisco. It was based on street sweeping and sewage treatment plant filtration system costs. They found that the total recoverable, this is all recoverable, annual costs across the city was approximately $6.5 million. Now, obviously, San Francisco compared to Salina, Kansas, there's quite a difference in data. However, you are still going to see costs associated with this cleanup, cost savings associated with this cleanup. Now, looking at healthcare costs, these are Kansas-specific numbers. In Kansas, smoking-related healthcare costs are about $1.12 billion per year. Smoking-related losses in productivity, around $1 billion per year. This accounts for a portion of the $170 billion direct medical costs that could be saved annually, according to the CDC. Another way to look at this, for every dollar spent on tobacco prevention, States can reduce tobacco-related healthcare expenditures and hospitalizations by up to $55. So for every dollar spent, we can save $55 in healthcare costs. So there are multiple benefits, and this is just a brief linking it all together. The overviews of these smoke-free parks: improved air quality, improved health, receive a public support, reduce secondhand smoke exposure, reduce smoking, and result in high levels of compliance among smokers. So here's the data collected for the Salina Parks and Recreation Master Plan in 2018. In this graph, you can see that well over a majority of those surveyed were interested in enacting some sort of tobacco-free policy in our park system. Only 20% are showing to be not supportive and 12% as neutral. And when speaking with the Parks and Rec Board, all members are currently supportive of this effort and are anxiously awaiting details of the ordinance. I presented to them about a month ago, and they were full of questions regarding the policy already about enforcement and details such as that. I reminded them that we are just in the beginning stages, and the action and further details will be brought about with collaboration, obviously, from the Commission. So with that in mind, we're going to go over what are the major elements of the policy that we would be looking at. So policy elements, there will be three main elements that we'll be discussing: what will be banned, where it will be banned, and how it will be enforced. So we would like to see all forms of tobacco product. This would include any type of combustible cigarette or cigar, smokeless tobacco, and e-cigarettes. E-cigarettes are very important. As you can see, the sign would clearly indicate all products, and any sort of FDA-approved medication for tobacco cessation would be allowed. This would be gum, patches, and FDA-approved nicotine inhalers. So there are nicotine inhalers that would be allowed in this policy, and nasal sprays. But this would all be clearly defined in the written ordinance. So where it will be banned, we would like to see the entire park system embrace this policy, excluding the golf courses. The highlights would be upon spaces where many people gather and there is a high concentration of youth, such as baseball diamonds and soccer fields and the playground areas. Particularly the playground areas, interestingly enough, are where you're going to find the highest concentration of tobacco litter. So how it will be enforced, this is kind of the tricky one. There are many different methods of enforcement. When looking at policies across the state, there are some of the main routes of enforcement that you will see: ask to comply, monetary fines, ejection, and graduated fines. Some policies simply ask those to comply. There can be the monetary losses associated with not following park policy, such as the fines and the graduated fines, or there can also be ejection from the park. Understandably, enforcement is a big issue. Who is going to police? Are we going to police? How can we keep this consistent and fair? This is something that we will need to address in detail and as we move farther along the development of the policy. And interestingly enough, in discussion with the Prevention Coalition group, it was brought up that the signs themselves almost have their own sense of enforcement. People generally follow heed, and the community will kind of self-police and self-enforce themselves. So that was one thing that our group, our coalition, had thought of. So policies in Kansas, I know this is incredibly hard to see, and that's why it's in the handout. That handout on tobacco-free park policies across Kansas is a fantastic resource to see what other communities are. And the other one that I added in there is Hutchinson's policy. Hutch has done a great job in Reno County. They started with every place but Hutch in Reno County, and then with success, they finally moved in and got all of their parks to be tobacco-free, excluding the golf course. I like using Hutch as a reference point because they're similar in size, structure as we are. So I included that in there just to show what they have done. But we can use these as blueprints and guides as we're going forward and shaping our policy. So there's lots of resources out there, and there's lots of communities in Kansas already doing this. So here are some pictures I took. One is actually a video, but I don't know if it'll play because I had to go through all the cigarette butts because they were just scattered over everywhere. So this is Oakdale Park over by the stage, and then just as I pulled up there, that middle picture it's a video of me going across the whole cemented area, and there's just cigarette butts littered there. It was a Saturday morning. Oh, you can play it? My turn at the end, I say something. It sounds kind of weird, so everybody's asking me what I'm doing. But they clean it up every week when they were doing yoga outside, and every week it would be the same. So hopefully you can see how many there actually were. I am recording all the cigarette butts over. So they're wondering what I was doing there. But that was a repeated thing every week as we would have our yoga sessions out there. Oh, there we go. So Sunset Park now. So I went and I collected at Sunset Park. This is just one of actually the smaller picnic shelter areas, and it was everywhere. And then of course under the bench over by the waterfall area there were cigarette butts there, obviously where people congregate. And the cigarette butt trash under the shelters is just enormous. And if you're going to think that's going to be a high concentration of people together, extreme secondhand smoke exposure, more than likely children are going to be around and involved, and that's really the focus, the drive that we're wanting to go to here. Now this is the very interesting part about Sunset Park. So as I was doing this, and I did this for a visual, where I collected, this is everything I collected at Sunset Park over there. And as I started doing this, I started in the grassy area completely away from the equipment. And I wasn't really finding anything. And I'm thinking, okay, this isn't good, so people aren't smoking here. Then I started walking closer to the equipment. The closer I got to the equipment, this is what I started to find. Because people are smoking right by the equipment as their children are playing, whatever they're doing. Right underneath the equipment, see that's where I'm kind of going, and it's all in just that one rounded area. Right underneath is where I found like 4 cigarette butts. That was my first, like, oh my gosh, and then I found all of those just inside that area. So where the smoking is occurring is the playground equipment, is the shelters, the places where people congregate. So that's really, really something that I was even amazed by as I was going through finding this data, this research as to what our parks look like. So to end this off, I just kind of want to say, why not? There really isn't a good reason why not. When talking with people in the community and even the coalition about this project, the reaction that I get has been rather similar across the board. Most people are actually amazed that we haven't done this already, or have already thought that we would have had something in place. I even had a comment in casual conversation about how smoking ordinances are one of the most beneficial things to public health and policy, which that was amazing to me because people are already aware of this, already aware of the impact, and know what it can do. So even this building, so this is a picture that was taken on this building. So even this building, these grounds have taken to creating this tobacco-free community, this environment. So there is the support there, and we just need to follow through. So these are some of the coalitions and groups that are in support of this: Saline County Tobacco Use Prevention Coalition, CKF, Live Well. I'm sure I could have put like Tammy Walker on there and others as well. So really quickly though, I do want to go over signage, just because that is a piece of the puzzle that we do somewhat have solved, and I want to show what it would look like. So these would be free, the signage that's available from KDHE. So this would be something that would be perfect for, say, the playground area, and this is for just the overall parks. And so we would get these free of cost. There is somewhat of a limit to them, but they will, they assign how many we get by how many parks the ordinance covers. And we'd have to have the ordinance and the policy before I can place an order and find out for sure where the rest of the signage would come from, or how many we would get. If we needed any additional signage, that's something that the coalition is more than happy to work on, and we've discussed some issues and routes and how we could possibly get organizations on board to help purchase signage if that was an issue. But so far, that wouldn't look at an issue. So if we're looking at any sort of costs at this point, I wouldn't say that there were any or much more additional costs except for putting up the signs. So that is all I have. I'm going to hand it over to Chris now, and then we can wrap up with questions after.
Thank you. I don't have a lot to add to that, but I did want to point out that there are over 30 jurisdictions in the state of Kansas that have a tobacco vape policy of some sort for the park system. Cigarette butts are one of the main time-consuming activities of my department to clean up in the parks, and as the pictures that Rachel showed, we can clean them up on a Monday, and by the following weekend, they're overflowing everywhere again. So it's very time-consuming for us, and as you all are aware, we are extremely short-staffed, so it's just something that takes away from other activities that we could be working on cleaning up or mowing. On May 15th, 1996, what's now known as TPEC brought forth a plan to not allow smoking in that facility. It wasn't until 13 years later, on January 12, 2009, that the city approved the Clean Indoor Air Ordinance 09-10481. So the Parks Department and the Park Board, we would like to try to advance an ordinance for your consideration as soon as possible. Obviously, I can bring the ordinance. We'll go through Mike and we'll review it first. I can take it back to the Park Board if that's your desire, but we would like to try to advance this before the end of the year if possible. Thank you. Stand for any questions?
I guess I would, go ahead, does anybody else?
I think, first of all, I think my main question is, obviously, different cities have approached it different ways, resolutions, ordinances, policy. Which route are you recommending? Obviously, the ordinance would have the best enforcement mechanism and kind of have the most validity. Is that what?
I would like to go with an ordinance and try to enforce it in the same manner which we enforce the Indoor Act, which was with a monetary fine.
Okay.
That would be the preference, although we're open to anything that you'd suggest.
I'm just speaking for myself. I'm extremely supportive of doing this. I think it would even carry more weight and help Parks and Recreation Advisory Board members help us be ambassadors of this cause if they had an opportunity to review this, not to stall it out or anything, because I would be hopeful we could get something done by the end of the year. But I just think that if we add another group of people who have looked at this and asked questions and can speak knowledgeably on the subject, hopefully we'll get better buy-in.
And I can have a draft ordinance to them by the next Park Board meeting.
Are we encouraging the age limit to be raised to 21? Is that in your thinking?
I'm not encouraged. I mean, I just want it to be stopped in the park system as a whole, no matter what age limit. I know Tobacco 21 is trying to get the age limit raised. I don't think that's necessarily my wheelhouse to get into, but I'm would like a complete ban, period.
Including the golf, would that include the golf course? Because the interesting thing is, I'm kind of surprised that what gets the golf course an exemption?
Yeah, why exempt the golf course? That was my question.
The golf course, I went through this when we were trying to pass this when I was in Joplin, and the biggest protest, because the golf course is financially driven, ours is an enterprise fund, I know that we will lose revenue off that because the golfers will go to other golf courses where they can smoke and vape and use tobacco products. I mean, I would like to see it across the board, but realistically, financially, I don't necessarily think that if we put this in place of the golf course, I think it will have some serious financial ramifications for us down the road. Not that I'm opposed to it, I just want to be clear that financially, I think we'll be affected negatively financially if we do it at the golf course. But again, I'm not opposed to it. I just realistically, finances, when I sit down with Mike at budget time, he's going to be going, hey, Chris, your golf course took a huge hit this year. And I'll be like, yes, sir, it did. Mike's shaking his head.
Yeah, I'm not a golfer, so I don't know.
And obviously, a lot of people like to smoke in the parks as well, because that's where you're finding the quantity of cigarette butts.
Yes, sir.
Those locations.
Well, and it's not just in the parks, and as she pointed out, it's all around our sports fields and our playgrounds where we're trying to protect the children. So at whatever comfort level you as a commission have, we'll entertain that, and we can come up with multiple different versions of ordinances for you to consider. But as far as cleaning up the parks, it would help the park staff substantially if we just banned it all across the public parks.
What about sporting events? Baseball tournaments and the like?
In the parks as a whole, yeah, I'd prefer to have it in the parks as a whole.
Won't that drive some tournaments away if we don't allow smoking?
I don't think it would necessarily drive the tournaments away. There'd be some parents who might be upset, but I don't think it's going to keep a team coming from Kansas City because smoking is banned in our park system.
How do you see the enforcement on this working?
Much as Rachel described it, I definitely think that if it's an ordinance, I'd like to see some sort of monetary fine.
So would we call you, or would we call the police department?
We'd call the police department.
Okay.
This is
Have
obviously
they
a
had a
discussion I
chance
need to have with.
comment on this?
I haven't talked to Chief about it yet.
That might be a good idea.
Yeah, absolutely.
And my question was, if we have any history as to how some of these other communities, because some of them have, even been ejected from the park or, not specified. So I'd kind of like to know how some of the other parks, how the enforcement's going.
Absolutely.
Because I could just see us trying to eject somebody from the park.
Is smoking prohibited on school district properties
It is.
completely?
I believe so.
Yes, so many feet,
Parking
So
lots.
many feet?
like 10 feet from the front door.
No, I'm talking about on the property.
Oh, yeah.
If I go to a football game at Central, can I smoke in that parking lot?
It's on USC 305 property.
Okay. Somebody's probably going to take me to task for this, but why not apply it to all public ways? Streets, sidewalks, particularly the downtown area. There's a lot of smoking that goes on out on the sidewalk in the downtown area.
That would be a discussion I think I'd have to have with Public Works Director as far as streets and everything else that's out of the park's purview, but I'm not opposed to it.
Mike's shooting me an evil eye.
I'm just listening.
I guess I have an issue with focusing on one particular thing and applying it to that only. I don't like exempting the golf course. I think that's inconsistent. Up front, I don't know much about it yet.
Right or wrong, I think a lot of communities have taken an incremental approach, and playground equipment is probably the easiest one to justify, and
Yeah.
in the collective mind's
I would
eye,
agree. Prohibiting it within, 50 feet of the playgrounds or whatever is probably the most effective thing to do.
What about smokeless tobacco? What's the age? Is it the same as smoking as far as being able to buy
It's 18,
smokeless
right?
tobacco?
Everything's 21 now.
Okay.
Tobacco 21 didn't pass.
Okay.
So everything's 21 now.
Okay. So as far as smokeless tobacco, that would apply to our ball diamonds and all that and everything?
Yes, that
so.
would be all a part of the
Okay.
policy.
Which I tried smokeless tobacco when I played baseball in college, and all it did is make me dizzy, so. it's not a big
yeah.
deal. It's not good.
No, it doesn't make you dizzy. It makes you very, very ill.
Yeah.
Any other questions?
No, I think this is great, and it's funny, I'm surprised we haven't tackled this issue already, so I just want to thank you very much, Rachel and Chris, and hopefully we'll have an ordinance back in front of us soon.
Thank you. Thank you very much.
I'm
I
excited.
do a couple things. Yeah, I would like to know a little bit more from some of the communities about how enforcement has gone, and if they've even tried to enforce it, and without enforcement, has it been successful? And if they have tried to enforce it, what kind of ramifications has that been? Let's see. It seemed like I had one other thing. Second of all, if we do this, I want to make sure we get it made out to the public. It's no different than the face mask. We need to make sure that we have both sides that have a chance to be here and try to be transparent and listen to both sides.
Yeah.
So.
Absolutely.
If I could address the staff for a moment. When we did the indoor smoking ban, our approach to enforcement, as I recall, was we would, if we got a report, we would then approach that particular entity, that restaurant or bar or whatever, and try to work with them to make sure that they understood that they had to do this rather than simply citing people.
I actually have that right here if you want.
I think one of the issues is, you get a complaint about somebody smoking at a playground, and by the time the police respond, the person's on the sidewalk adjacent to the park, and they're perfectly legal. So I think that, it's one of those things that is probably heavily reliant on voluntary compliance.
Yeah, but
Or peer pressure.
Or peer pressure,
Right.
yeah.
And at least it sets forth our expectations.
Yeah.
But, something I feel like we kind of got behind the 8 ball with the masking ordinance was there was a real narrative put out into the community right from the get-go that because of its difficulty to be enforced, that we weren't going to be enforcing it. And at any rate, I would just like to, I'd like to avoid that if we can, acknowledging that exactly like you said, you can call the non-emergency line, get an officer out there, 20 minutes later, the person isn't there.
Yeah, that is going to be problematic, and then the folks who report it are going to say the city's not enforcing it.
Right.
So we need to be ready for that sort of kickback when that happens.
I appreciate the fact you're discussing it, because that is probably my biggest concern in all of this is, with respect to the implementation of the Clean Air Ordinance, that predates my time with the city by about 6 years, but when I arrived, hotels were the conversation, and we were taking the approach that you described, that we'd get a complaint, we'd reach out to management. If we had recurring complaints, then the police department would get involved and talk to them about the enforcement and fine schedule, and I don't know that it ever came to that, but it did require some ongoing conversations with a few.
Is it a resolution order? What is it that, I know during the River Festival, that's a no smoking area. How do we have that enforced?
We treat the Oakdale Park as and I'm going to draw a blank on the term, but as a venue under the control of the renter, whether that's KKOA or in that case the River Festival. So it was the Arts and Humanities Department that chose to impose that as just a requirement of their event. So it's not necessarily by ordinance or enforceable other than admission to the event and possibly being asked to leave.
Because I know from working the gates, there's the gate we work, we have, we were sending people over the bridge to smoke because they were allowed to smoke on the other side of the bridge. And so that was...
Yeah, we viewed it more as a controlled space under the operation of the River Festival, and they could make that rule as part of their event planning.
Of course, with this enforced, you'd have to send them 2 or 3 blocks down the street because Tony's is right next door, and I guess they go out the other side of the park and across the street. But
and you get a few complaints, but it was minimal. Okay. Any other
Sensing
questions?
consensus that we should keep moving forward.
Yeah, any comments from the public? We have some here.
I'll say this much.
Could you please come to the microphone and give us your name and where you're from?
Okay, my name is Maria Charbat. And, people are just kind of expecting that they can't smoke at a lot of places anymore. So we have found that signage has done has been a great deterrent to people smoking, just sticking those signs up there. And if you're going to smoke right in front of your kid and the sign says no smoking, there's going to be a little pressure put on them. So I think the public is just kind of expecting, they just can't smoke most places anymore. So, I personally don't think it's going to be that big of a deal, but sometimes I'm surprised on things too. So anyway, that's what my thoughts were. Thank you.
Thank you.
Brenda Gutierrez with the Salina Area United Way. And as you know, the Salina Area United Way, we fight for the health, education, and financial stability of all people. And when it comes to health, it's decreasing risky behaviors. And if you look at the data that was supplied by Rachel today in the summary from KDHE, how can we make a difference with decreasing risky behaviors? How do we increase people's financial stability? She talked about what our cost savings is, that the Kansas dollar, and how we can make a difference with that. And I'm sure with education, these signs, there's some other things with youth, how we have that opportunity to shape the values and the norms. So I encourage you to support this as they're working forward with all the different boards and commissions and their special interests. So thank you.
Norman Mantle, Salina. Till you improve your response time from law enforcement, you're not going to accomplish anything. It takes them 15 minutes to get from the police station over here to the library. I was there when it happened.
Thank you. Any other comments?
Mr. Shrag, how much do we receive in tobacco money each year as a city? Isn't it partially in compensation for people's use of cigarettes?
Yeah, I honestly don't know the answer to that. I can track that down, but I don't know off the top of my head.
Okay, any other comments? So, okay, well, we'll look forward to the next steps and then again, open it up to the public and seeing what the public has to say. So, thank you guys for being here. And with that, our study session is closed and we will be back here at 4 o'clock for our regular meeting. Thank you.